Hello, Namaskaram. The South Indian is here. You know, in the new year, everybody makes resolutions. Not everybody, but lots of people. It's a kind of a norm, and you say, what are you planning to give up, or what are you planning to start this new year? But for many of us, it's done and dusted. I think that we need to really get real, and that's a resolution that I, of course, follow, that let's get more real than what it is right now. Boring, many would say, but that's how this South Indian is. But you know what? Let's begin this new year with something positive. There is, of course, the good, the bad, and the ugly in the world, but the South Indian shall focus today on turning the ugly into good. We are going to have a very frank and open conversation about the C word, that is COVID. It's around, but why is it that I feel we are kind of blasé about it? You know, I'm going to turn to camera one again, and I'm going to show you what we are talking about. Look at that, ladies and gentlemen. That's what we are going to talk about, slaying COVID in 2024. So let's come back to the story that I said that I feel that we are blasé about it. To not panic is of course good, but to be complacent is kind of foolish, I feel. It's like we want to brush it under the carpet, but the South Indian won't. We shall talk about it and defeat it. So first, about the situation regarding the new subvariant JN.1. A total of 197 cases of COVID-19 subvariant JN.1 has been detected so far, and the new addition to the list being the state of Odisha. If we talk about the overall situation, according to the Indian SARS-CoV-2 Genomics Consortium or INSA-CoG, then of course 10 states and union territories have so far confirmed the presence of the JN.1 subvariant, and the pecking order looks something like this. Right on top, Kerala with 83 cases, Goa comes next with 51, Gujarat is at third place with 34, Karnataka 8 cases, Maharashtra 7 cases, Rajasthan 5, Tamil Nadu 4, Telangana 2, Odisha, like I said earlier, 1, and the national capital Delhi at 1. Insofar as COVID-19 cases are concerned, India has recorded 636 new infections and thereabouts, while the active cases stand at 4,394 according to the data released by the Health Ministry on Monday, and 2 deaths have been reported according to the latest data.
Today we had conducted a meeting of all the institutes which are coming under the medical education department to test the preparedness of the hospitals, because the number of cases are rising. So we have asked all the directors and the medical superintendent to be prepared, and we have also instructed them to set aside some around 50 beds in each institute, and even some ICU beds are also available. We had called a meeting to check the preparedness.
Is there a decision taken?
No, decision is now, you see, people need not worry, because this variant of Omicron, JN.1, is not so, it doesn't cause a severe disease. So, people need not panic on this. The only thing is, people who are above 60 years and who are comorbid, they need to take some precaution, they need to wear the mask.
I'm sure scientists and doctors know their job. I'm not here to teach them that. When I say that, I quote the WHO, which has classified JN.1 as a separate variant of interest given its rapidly increasing spread, but it also said that it poses a low global public health risk. Okay, that sounds like great news. But then the number of daily COVID-19 cases had dropped to double digits until the 5th of December last year. But then the cases went up after the emergence of JN.1. Also, JN.1 cases continue to be reported not only from multiple states, but also several other countries. If we talk about at home, what's the situation so far as this is concerned? Last week in Karnataka, there were 922 fresh cases, which is, of course, it went up. There is a threefold increase. This figure that I read, which is 922, is an increase from 309, which was recorded the previous week. So, increase happens. In Maharashtra, cases increased from 103 to 620, which is a whopping 6-fold. I mean, this is absolutely whopping, I feel. The center has asked the states and union territories to maintain a constant vigil because there's been an uptick in the number of COVID-19 cases. But you and I, the people of India or Bharat, whatever you want to call it, we need solid, definitive solutions and self-discipline to overcome this new subvariant this new year. Let me now introduce you to the experts, perhaps, who can actually explode all the myths so far as JN.1 subvariant is concerned. We shall be joined by several guests, but as of now, Dr. Anita Ramesh, Professor of Medical Oncology, Apollo Hospital, Chennai, is joining us, and also Dr. Sunila Garg, who is member Lancet Commission on COVID-19 and Professor of Excellence, Chair, Program Advisory Committee, National Institute of Health and Family Welfare. A very warm welcome to both of you. Great to see you, Dr. Anita. It's been a long time. And also Dr. Garg, wonderful to see you. I like a women's panel, I've always wanted more women on my show. I'm so happy you guys are here, and that too, in the new year. So first is, I want to, like I read in my introduction, both of you are doctors. I just want to, Dr. Ramesh and Dr. Garg, want to bring to your notice, somewhere I feel we are being very blasé about it. It's like, it's all right, it's okay. I know you doctors always say, do not panic, do not panic. But the point is, we can't brush it under the carpet, and I will talk about anomalies. Number one, Dr. Ramesh, doctors are now saying, whether it's in Telangana, particularly in Kerala, also in Karnataka, they are saying, look, if you have persistent fever, you should go get tested. You and I, we've all lived through a period where a slight cough and would say, please go get tested. Yeah, you never know. We all got tested. I have got tested at least 11 times since the time COVID broke, because one had symptoms. So, Dr. Ramesh, how do you ascertain that someone who shows symptoms of fever, cough and cold should immediately go for a test?
No. The thing is that if you are getting fever, cough, cold, chills, body pain, we tell the person to isolate themselves. Okay, isolate, keep yourself away from work, keep yourself away from everybody, and confine yourself to the house. Yes, 24 hours, 48 hours, maximum 72 hours, we tell them. Paracetamol is the only drug you should take at that time. Do not panic, do not rush, nothing to do. But during this 72 hours, if your condition deteriorates, if your fever becomes very high, if you are become very tired, fatigued, sleepy, okay, you feel weak, but then immediately rush for medical care. After 72 hours, fever did not subside, or say another couple of hours, if you have not subsided, then visit the doctor. And once you reach the hospital, the doctor takes up all the things and might do a testing. So yes, answering to your question, do not rush and do the test immediately. It may be a non-specific viral infection. But yes, a persistent fever, rise of temperature, and tiredness, weakness, coughs, throat, body pain, give a time for 72 hours, provided you don't deteriorate, go to the hospital, and the doctor takes a call whether the testing has to be done or not.
All right. Dr. Garg, would you like to take that question? First is, I want to bring to your notice the larger question. It's a perception, and it's not just my perception, and any kind of perception, experts have to actually explode that myth. Are we being rather light-hearted about this? Are we saying this shall go away? I know, like I'll repeat myself, ladies and gents, I don't want to create panic, paranoia, neurosis here. But there is a limit to it. In the new year, we need to get real. Would you agree, Dr. Garg?
I think, basically I like to say that, COVID had never gone out of our lives. That is one thing. Once, the virus is amongst us, it is bound to, kind of, depending on the situation, because the virus, once it is there, it's going to multiply, and it is also undergoing mutation as well, once it is there. So, this is something which has happened, the mutation in spike protein. So, and this was also accidentally detected during the genome sequences. So what I would like to say at this point of time, we need not panic, but we need to be vigilant. That is one thing which is very important. And that's where, when Dr. Anita was pointing out that we need to be, kind of looking at, we need not be paranoid ki ek din ka fever hua and we just go and get ourselves tested. But we need to see that, we need to isolate ourselves and watch for the symptoms. But at the same time, it is important that the system's preparedness is there along with the home preparedness. What I say is that when people are, should behave responsibly, and they should say that if they are, feeling the symptoms of COVID, which was already pointed out in terms of high grade fever, is this time, persistent cough is also one of the symptoms along with severe body ache and all that. So that is where, we need to be, educated about the whole problem, and then similarly isolating ourselves. But plus, it's the system preparedness which is very, very important. And again, we need to also follow, the norm of, mask or social distancing, which we were practicing earlier. And most important is our hand hygiene. And particularly when elderlies are at home, we need to be much more vigilant, because, if elderlies are there, then are also comorbid. That means either diabetes, hypertension, cardiovascular diseases. We need to look at that part.
Yeah, but Doctor, Rajiv, let's say welcome Rajiv Jaydevan, Dr. Rajiv Jaydevan, co-chairperson, IMA COVID Task Force and former president, IMA Kochi in Kerala. Rajiv, very, very warm welcome to you. Rajiv, somehow whatever you are all saying and you will say right now, there is a feeling that we've forgotten that. We are being very blasé about it. Hand hygiene, like Dr. Garg just now said, even before that, Dr. Ramesh said, look, if your fever persists for 72 hours, please go and see. There is body chill and everything. But I get a general feeling, and I am not saying this because in Delhi the cases have increased. We just are taking it very light-hearted fashion. In the new year, we need to slay this. We need to show the same kind of fixity of purpose that we as a nation showed. Do you think that we are being slightly lax about it? Is it genuine, this laxity, or do you think we need to kind of go back to being vigilant, Rajiv?
As Dr. Garg said, COVID never went away. That is for the world of science. But for the general public, for the regular person who's not a medical doctor, they don't see the effects of COVID anymore, at least the overt effects. Things like deaths in large numbers, hospitals being overburdened, lack of oxygen, things like that. So from the common man standpoint, it is somewhat expected that they will have a lax attitude about this. So it is the duty of healthcare professionals like myself, Dr. Garg, and responsible media personalities like yourself to let them know the truth and the facts without causing panic. And that is exactly what you said in the beginning of this program.
Right. And I'm going to come back to, all of you. I have to take a break right now. But then I'm going to come back and talk to Rajiv Jaydevan about this new paranoia because of sudden deaths and particularly heart ailments. But as of now, I'm taking a break, but I'm requesting all the doctors on the expert panel to please stay with me. Back in a jiffy.
This was intended to be a terrorist spectacular without precedent.
The plan was to bomb 2 Air India passenger aircrafts simultaneously.
There was a loud explosion and the whole plane just vanished.
The police dropped the ball, the intelligence officers dropped the ball, and the politicians dropped the ball.
It was a conspiracy that destroyed my life. It destroyed 331 lives.
News is now content. Just stream it. Download the world's first news OTT, News9 Plus, ahead of the curve.
All right, welcome back, ladies and gents. I'll go to camera 1 because I need you to catch what we are speaking about, and that is what we are speaking about. Let's put that up. Slaying COVID in 2024. That's our focus, and I think we are all duty bound as Indians, like Dr. Rajiv Jaydevan said, so that we are aware minutes by minute. What a better way to start the year than to be vigilant, than to be cautious. Also joining us, Dr. Sharat Kumar Agarwal, immediate past National President, IMA. We are also joined by Dr. Anita Ramesh, Professor of Medical Oncology, Apollo Hospital in Chennai, Dr. Rajiv Jayadevan, Co-Chairperson, IMA, COVID Task Force and former President, IMA Kochi, and Dr. Sunila Garg, who is member, Lancet Commission on COVID-19 and Professor of Excellence Chair Program, Advisory Committee, National Institute of Health and Family Welfare. Rajiv Jayadevan, I wanted to ask you before we took a break, and I'm going to take another one, but in a bit. Rajiv Jayadevan, on the screen, please. Yes. You know, they are saying about the sudden deaths, which is now that it could, JN.1 could lead to, there is some Japanese research, could lead to heart issues. Apparently, it clings on to ACE2 receptors, which is very common in the heart. People who catch the virus may suffer from reduced cardiac function, infected likely to have persistent viral infections in their hearts. Rajiv Jayadevan, is it, I mean, explode the myth for us in the sense that perhaps it could happen, but it is not something which should create panic, because you know that over the past 1.5 years, a lot of fit young people have been having, you know, myocardials.
Yes, young adults have always had been dying. It's just that we don't talk about it so often. But now, since the onset of the pandemic, these things have come to attention. But it is also true that the rate of death has increased, and the reason for the rate of death is believed to be COVID, because the rate of death among people who survived COVID, even before the vaccines were rolled out in 2020, there's a large study from the UK Biobank from Britain that showed that people who survived COVID had a higher mortality rate, higher death rate compared to those who did not have COVID.
Right.
That is before the vaccines came out. And the same trend occurred even after the vaccines were out. So it is true that the total death rate has increased, and most of them appear to be cardiovascular. And therein lies the theory that COVID is a virus that can also affect the blood vessels of our body. And our blood vessels have an inner lining which is called endothelium, which is not a piece of wallpaper. It's actually a living tissue which works as a sensor. Endothelium basically works as a sensor for our cardiovascular system. It controls a lot of things that our heart and our blood vessels do, such as the tone of our blood vessels, the pressure of our inside our system, and plenty of feedback mechanisms built in. So any virus that affects the health of our endothelium is not really good news and should not be confused with a common cold virus. Common cold viruses do not affect the heart or the endothelium or the blood vessels, and they do not cause deaths, regardless of how many number of times you get common cold. So many people call COVID the common cold. That's like calling polio a diarrheal disease just because you get diarrhea at the beginning. It is not. The initial symptoms, for many people, it's true that it may seem like a cold, but that's because the virus enters through the nasal system, through our nose and the lungs. But as it enters the bloodstream, it can affect our blood vessels. But then there is no need to panic, in the sense people who have survived COVID have a slightly higher death rate, slightly higher risk of cardiovascular events compared to someone else. It's almost like saying someone who smokes has a slightly higher risk of cardiovascular events. But if you take many people who smoke, you'll see many of them do not have these problems. So the message here is, don't take COVID lightly. Don't blow it off. Try not to get it, because this thing comes in waves. We saw the last surge in India was in May, April of last year. And then in November, cases started creeping up after a 7-month gap. And when that happens, it's important to stay cautious, not to get infected. As Dr. Garg said, some of us live with older people. Try not to get them infected, because their health may not be as good as that of younger people, and they could have complications. But back to your question of sudden deaths, yes, sudden deaths are an issue, and the common causes of sudden deaths are, one, abnormal heart rhythms that occur in a small number of individuals, that can occur even among people whose heart appears normal on a scan. The second is heart attacks, which is basically blocks that occur in the arteries that supply the heart. And these blocks occur either from diabetes, which is a lifestyle disease, can occur from smoking, or binge drinking of alcohol, which basically means consuming large amounts of alcohol over a short period of time, which is something which is quite common in the subcontinent. High cholesterol level, abnormal blood pressure levels, uncontrolled diabetes, and family history of heart disease are all well-established risk factors, as is lack of exercise. So as the new year comes in, I think it's important we create some resolutions to make ourselves a little bit more mobile, improve our step count, walk a little bit more. Those who are smoking might want to cut it, stop it. Those who drink might want to stop it or cut down to minimum levels.
Okay, let me welcome Dr. Sharat Kumar Agarwal. Dr. Agarwal, you know, there are some experts who've been saying, look at Japan, look at people in Singapore, they are all masked up. In India, we don't have that. Do we lack self-discipline, Dr. Agarwal? Is it time that, you know, there was of course a time in Japan where it almost became a mental problem for a lot of people because they were always masked up. Maybe that is also not a very nice thing. But do you think, Dr. Agarwal, that with JN.1 around the corner, we need to be more disciplined?
Yes, we need to be a little bit more disciplined. But see, I don't follow what the other countries are doing. See, their circumstances, their environment, their geographical conditions are different from India. The immunity, the resistance power in a normal Indian is larger, bigger than any these countries which you are mentioning. And you have seen the impact of the COVID also. When in 2 years, when there was COVID pandemic, we saw the disastrous thing in these country and compared to the India. But yes, I am 100% agree with all of you, all the panelists, that we should be more disciplined. We should not take it very lightly as the new variant has come, and though it is more infective than the severity.
Yeah, I'm coming to
that. It is not that much. It is not causing that much of severity.
All right,
No,
Dr. Ramesh,
not much mortality.
All right, Dr. Ramesh, the big question.
do
Let me
put
come
the
back
mask.
to you, Dr. Agarwal ji. Let me come back to you, Dr. Ramesh. I want to ask you, Anita, that you know the thing is the big debate about vaccines. There are people who are sitting in street corners now and debating and saying, oh, the vaccine has not worked for me. Should I go for a booster? I have called up doctors in big hospitals and they say, maybe, maybe not. What's this mystery about? Should I get vaccinated or go for another booster or not? Will it help me? Will it help my mother-in-law who's really elderly?
Yeah, just answering your first question, yes, vaccine was a success and we were able to control the COVID pandemic. We may not be out of COVID, but we are out of the pandemic. So vaccine helped and it has helped 80% of the population and most of us are all vaccinated and that's why we are living. So that goes without saying. Now, COVID, the virus keeps mutating and it's a natural history. They can come back 5 times, even 7 times in the natural history. Now, yes, this is the mutant form of the BA series, which is now prevalent here. More infectious, but not that dangerous as far as what the data is involved. Yes, my gut feeling, we might need a booster dose because remember, when you give a vaccine, the antibodies inside your antibody produced in your body remains for a certain period of time. After that, it backs and wanes. That's the concept of booster dose. We gave 2 and we stopped because we were almost done with the COVID and not much of cases. Now a new strain has come. Genomic sequencing is on the way, we do not know. But it is the same descendant of the Omicron BA virus. So certain portion of the genetic material is the same.
All right.
So our old vaccine is going to definitely act to some extent.
So how do you know?
100%.
You're very well said, you know, Dr. Anita Ramesh, who's a professor of medical oncology. But Dr. Garg, I want to ask you, so what is the time? Suppose I got it like 1.5 years ago and I'm in my 50s, or someone got it like 2 years ago and is in his 40s. Someone has diabetes. You know, where is the information? I don't see. I see you and us, we guys are discussing this. Otherwise, I don't see a major discussion at all. Stay vigilant is what we hear. There is no guideline, doctor.
You see, guidelines are there, but you know, as News9 channel is discussing, it is more required that we discuss about this more on the media channels, on the print media or on the when we say digital media and all that, this is a very, I'll say appropriate step on part of News9 to discuss these real-time issues. Apart from be vigilant and all that, this is, when we had the first show on News9, at that time also I'd mentioned that boosters are going to work because it is, some portion of it's a variant of Omicron only, like, so that's where, I'll say that particularly when we are talking of elderlies or we are talking of comorbidities, these people should be first on the priority list, that they should go and get, the boosters, because this is where, we lagged. People took 2 doses, and at that time, Omicron was a variant of support also for us, because everyone suffered from that, but then everyone did not suffer in a serious way. Along with vaccination, these together, they worked. So I feel that, and at that same time, people became complacent about the booster doses, which was already there. So it is important that at this point of time, while the vaccine industry is doing research in its own way with regard to, different types of vaccines, maybe, subsequently we may come out with the, a routine vaccine, which is according to the circulating strain. But till that time, we need to give advice about the boosters, and particularly, as I said, depending on the priority population, which is about our elderlies and people with comorbidities.
All right. And to all the doctors on the expert panel, I'm taking a break yet again. Please stay with us. I'm coming back and I'll go to Dr. Rajeev Jaydevan with my next question. How to slay COVID, particularly this new subvariant JN.1 in the new year. Stay with us.
Pakistani spy agency ISI's sinister plan to target India. Training women to honey trap top civil and military officials. Counter honey trapping ops initiated by India. But gullible victims still caught in the web. Top military intelligence experts break down the web of deception. Colonel Hani Bakshi explains the phenomena of honey trap.
जहाँ पे भी आपको लगेगा, उनको लगेगा कि there is a person who is susceptible to women, who's making a lot of women friends on the social media. That is where they will make a spoof account and then start luring the person.
Colonel Pavitran Rajan decodes the psyche of the victim and the predator.
But when you go up the chain, no one enforces it to people at the top. That disciplinary regime and the security regime is not enforced at the top. And they usually have a public profile where it is much more easier to approach that person.
A News9 special on how modern technology has added teeth to the ancient spying tactic.
Our story takes you inside Pakistan's honey trap machine.
This and more, streaming on world's first news OTT, News9 Plus. Download now.
Bangalore traffic is an example of something that has gone wrong with our system.
We have more than 50 flyovers in Bangalore city. If flyover is a solution to traffic problem, Bangalore should not have traffic problem.
According to TomTom Traffic Index 2022, Bangalore is ranked as the second worst city in the world when it comes to traffic.
The speed limit at the ORR is 80 kilometers per hour, but our vehicle has only moved 10 kilometers per hour.
What Bangalore needs is a surgery, but what we have been offered repeatedly are band-aids.
Only on the world's first news OTT. News9 Plus, ahead of the curve.
The scale of the attack was something that we were surprised at. David Hadley was a double agent. The Americans did not want him to be fully exposed. So all that he probably shared with the Americans was not shared with us in terms of intelligence. If we had that, I'm sure that we would have been able to deal with the situation far better.
This and more streaming on world's first news OTT, News9 Plus. Download now.
Welcome back and thank you for staying. The South Indian is here. We're actually resolving to how to slay COVID in 2024, and what better way than to discuss it with experts. Before I went into the break, I mentioned how I'm going to go to Dr. Rajiv Jaydevan for my next question. You know, so far as JN.1 is concerned, they're saying do not worry, do not panic, it's not something which should be bothering you. Dr. Rajiv Jaydevan, but look at the words that are used along with the subvariant: transmissibility, virulence, antibody evasion, susceptible to therapeutics, and detectability. I mean, if you have words like that which is associated with a subvariant like this, then obviously my question is, are we being very blasé about it? Seems very, very pertinent, Dr. Jaydevan.
It depends on whose viewpoint you're looking at. If you take an average person who's in reasonably good health, who's on the younger side, for that person, it doesn't seem to be an imminent threat, at least on his or her life. So therefore, a large number of people tend to be complacent about it. That's one. But if you look at it from the viewpoint of someone who's much older, say some person in the 80s, person with chronic liver disease, person with chronic kidney disease, someone with cancer, someone with lung disease, they may not necessarily see it lightly. And the third is from the point of view of the population or for the policymakers, they need to make decisions based on how the disease affects large numbers of people. For instance, what is the effect of COVID on productivity? For instance, if many people get sick at the same time, who's going to run the show in the country? So those are all questions that should come up. And secondly, one other aspect is, even though the death rate is low, it is still there. And I know of people who have died directly from COVID as recently as last week, including doctors. So it is not, it hasn't gone away at all. You asked how to slay COVID. Now, 4 years on, we know a lot more about it than we did in 2020.
Right.
I'll say this thing is going to keep coming back at us. It's a smart virus. I guess all viruses are smart, but this one is new to us. It keeps changing itself. And this particular one, JN.1, attracted worldwide attention, not because it wasn't a small change that that gave birth to JN.1. It was a very large change in the genetic structure. So a virus is suddenly able to change a large amount of its genetic structure and still cause similar disease symptoms. And one scary part of JN.1, which many people don't realize, is a single mutation in its spike protein dramatically altered its ability to infect man. So think of what possibilities could happen in the future. Right. So we'll leave that as an unknown. It is not something we should take lightly.
And doctor, so let me go to
if you want to slay it, you wear a mask in crowded spaces. If you have a fever, you stay home. Don't spread to other people. I think if people do these two simple things, we can tide over this without much difficulty.
I'm running out of time. Anita, I want to ask you that, why is it don't you think respective state governments and also the center has been giving, health ministry has been issuing a lot of list about the to-dos and not to do. But don't you think it's time now that the government in the new year should actually step it up, and like Dr. Garg also said, inform. Like earlier we would say test. Don't you think they should now, it's time that they did it?
Yes, the numbers are rising. I think with the new year, that should be the slogan. Isolate yourself, wash your hands, wear the masks, don't panic. And if the fever persists, get tested yourself. And yes, be aware. I think it's a high time. And I think government is doing also, have started, both the state government, central government. Even in our hospital, we have circulars running from the management side to start wearing the mask So yes, I think it is on, but we need to intensify it.
Dr. Garg and Dr. Agarwal, don't you think it's time that the government issues very, very strict notifications so far as this is concerned? I think we are still lagging in so far as telling people about it. Dr. Garg.
You see, from the center's part, I like to say that the notices have been issued. Mock drills are being carried out because, as soon as we got the first information, our health minister had already convened a meeting and sensitized and talked to the state health ministers also. But now it remains on the states also how to, strictly implement this and carry out on the mock drills also. And plus, have, awareness sessions, whether it is at the community level or at the health providers level. So we need to act, in a multiple manner so that information percolates to the last mile. That is important.
Dr. Garg, in Karnataka, for instance, in the initial, a week ago, I was speaking with Dr. Rajiv Jaydevan at that time. Karnataka had started doing temperature checks in school. Very wise. I think we all need to every state needs to do this. It's high time. You doctors always say, it's prevention is better than cure. So there has to be prevention, which is what I think we have to do in this new year. I individually feel very strongly about it because all of us had faced the C word. Remember, it's only been like 3 years now. Thank you so much, Dr. Ramesh. Thank you very much, Dr. Garg. Thank you, Dr. Jaydevan. And also thank is due to Dr. Agarwal for joining us on this first story on the show where I said, let's you and I together slay COVID in 2024. All right, the South Indian is back and with story 2. It's all very well to keep talking about how a vibrant democracy, it's the people which matters, it's about people's issues, it's about problems of the people. They are the ones who actually go and press the button and they are the ones who decide the fate of politicians. But how many people or how many politicians actually do that? They do it sometimes for just optics, but once the elections are over, they've occupied the chair, it's all forgotten. Today, my focus is going to be on Telangana's new Chief Minister, Revant Reddy. We've all heard the saying, history repeats itself, first as a tragedy, second as a farce. In the context of Telangana, this is exactly what the current Chief Minister, Revant Reddy, doesn't want to risk doing. One of the reasons the previous BRS government under KCR Garu lost elections despite a slew of welfare measures is because he was said to be completely inaccessible. There was a general feeling that except for his close family members and coterie, no one could get close to K. Chandrasekhar Rao. You can call it optics if you want to, but Revant Reddy sent out a great message when he ordered that the barricades in front of Pragati Bhavan, which was the camp cum office residence of K. Chandrasekhar Rao, should be removed. He also renamed the premises as Mahatma Jyotirao Phule Praja Bhavan, the operative word being Praja, people. Therefore, this new government, much like the governments of erstwhile chief ministers of undivided Andhra Pradesh like Chandrababu Naidu and Y. Rajasekhara Reddy, has begun its stint by reaching out to people, to those who matter in terms of both the success of their schemes and also as voters for perhaps Lok Sabha elections this year. Revant Reddy's government has kick-started the Prajapalana, meaning People's Rule scheme, which is focused on taking the government to the doorstep of the people instead of the other way around. Under this scheme, on all working days, all 8 days, officials shall visit at least 2 villages every day to collect applications from the people in a particular format during Gram Sabhas. And on the first day itself, more than 9 lakh applications were received under the Praja Palana scheme in Telangana.
Congress Prabhutvam, Indirama Rajyam, Soniyamma Andato, Mallikarjun Kharge గారి నేతృత్వంలో రాహుల్ గాంధీ గారి యొక్క సూచనలతో ఈ రాష్ట్రాన్ని అభివృద్ధి పదం వైపు నడిపించి మేము పాలకులము కాదు, మేము సేవకులము, మీకు సేవ చేయడానికే మీరు మాకిచ్చిన అవకాశం. ఈ అవకాశాన్ని బాధ్యతగా ఎంతో గౌరవంగా మీరిచ్చిన ఈ అవకాశాన్ని ఈ ప్రాంత అభివృద్ధి కోసం వినియోగిస్తానని తెలియజేస్తూ.
Now, what is Revanth Reddy's government saying? According to the government, Praja Palana is to take cognizance of people's complaints and create a comprehensive database. Like I said earlier, KCR was known for his welfare measures, Raitu Bandhu, Dalita Bandhu, all these schemes. And despite its initial success, there came a time when many complained that how the delivery system was utterly faulty. Therefore, Praja Palana, which aims to ensure that the benefits of the Congress's 6 guarantees reaches the people and on time. On your screens right now, the Congress's promises. There is a monthly financial assistance of 2,500 to women every month. Then comes Mahalakshmi scheme, LPG cylinders at 500 rupees. Next, 15,000 rupees per acre per year to farmers. Bonus of 500 rupees for every quintal of paddy. Raitu Bharosa, 12,000 rupees to agriculture labourers every year. Grahajyoti, free power up to 200 units to all the households. Indrama Indlu, this is 5 lakhs for construction of houses to BPL families. Indrama Indlu, 250 square yards for Telangana movement activists. Additionally, 4,000 monthly pension to senior citizens, single women as also widows. Rajiv Arogyasri, 10 lakhs for medical treatment. So, those are the promises, and this entire scheme of people to people contact, Praja Palana, is to help people to see that, you know, who are these people who live in a particular area, what are their complaints and how best to service them. You know what, let us not forget that Revanth faces a huge challenge as the coffers are running empty. The debt servicing burden is pegged at 22,407 crores of the total budget outlay of 2.9 lakh crores for the current financial year. Moreover, there seems little chances of imposing new taxes or duties in the near future. He does have a challenge. So, if Praja Palana initiated by Revanth Reddy yields results, then it is clearly one of the major wins of the newly minted government in Telangana. I am about to say goodbye to you. But as always, after the South Indian, you will see something very special. Do you know what is coming up? Even as India looks up to harness the power of AI, how can laws and regulations be put in place to crack down on deepfakes? Very, very important indeed. What do you remember Rashmika Mandana's deepfake? Something like that. Watch this and learn what it can do to this country. On that note, this South Indian says Vanakkam, Namaskaram, and we meet yet again and take up issues which are actually concerning you, the people of India. Vanakkam.
Seeing is believing.
Or is it? You know it's true when you hear it yourself. Am I right? Or wrong? These are your favorite celebrities that you saw in the videos. But what if I told you